My name is Bettina Harrington. I'm in the WU 1 Nurse Practitioner Program. For my capstone project, I went to Argentina for an observation and in April of this year, and my focus was primarily made on to nursing, the healthcare delivery by doctors and nurses, the working relationship between the two, and whether there was an opportunity for nurse practitioners to advance nursing in Argentina. Currently, Argentina does not have any other nurse practitioners or any other types of advanced nursing practice that works independently. And to really understand and know what's going on in Argentina today you need to understand its history and where they came from. The historical events that occurred in Argentina, I believe, are the reasons the healthcare system may be viewed as being disjointed. Proposed ideas on how nursing in Argentina may benefit from advanced practice nursing is a direct consequence of the historical events that occurred in Argentina. Argentina, South America, is composed of 23 provinces and one federal district of Buenos Aires, similar to like states in the United States, and then the federal capital being Washington. It's Buenos Aires, and that's where I did my my observation was in a public hospital in Buenos Aires. In 1913, Argentina had achieved development and was considered a top 10 wealthy nation before spiraling into overwhelming poverty by 1976. In the years 1976 to 1983, Argentine government changed drastically. They were a democratic society, and then the military regime took control during these years. They're historically referred to as the Dirty War, which was a war declared on socialist citizens of Argentina. When Argentina came back, when democracy came back to Argentina, President Nestor Kirchner restructured Argentina's debt and succeeded in financial austerity by growing the gross national product and renewing foreign investment. Today, his wife, President Cristina Ferdinand de Kirchner, continued her husband's program of economic prosperity. Here you can see 1974, the gross national product, very low. This was in the beginning of the war. When the military regime took over, you see a slight rise. This was during President Menem. He was this was at the very beginning when democracy took over, and he imposed an economic austerity program that attempted to rein inflation by making the peso equal to the value of the U.S. dollar and privatizing numerous state-run companies, using part of the proceeds to reduce the national debt. This economic strategy was successful for 10 years, but proved unsustainable when the U.S. dollar began to rise, resulting in high interest rates, which forced the government to borrow massive amounts of internal monetary funds. So by 2003, 2002, you see over half of the population of Argentina were below the poverty line, which is quite a bit, especially in the provinces that were already poor. And now you see a new economic rise with the new president. This is the literature review of the historical data collection. I'm not going to go through it for time's sake. The problem in healthcare today in Argentina is the public administration has been profoundly influenced by the rupture of Argentina's economic, political, and social collapse. So today you see when policy making in healthcare, it becomes too personal, too political, and too unregulated. The healthcare system is divided into three sectors. There's the public sector, which is free to all citizens of Argentina, and a subcategory on the public sector is PAMI, which is equivalent to Medicare in the United States. People that had obras sociales that are over 65, no longer working, go on to the PAMI. There's the private sector, and then the obras sociales, which is with unions. If you belong to a union, a workers' laborers union, you have the obras sociales available to you. The public system is financed through taxes that are collected, public taxes. The public system is available. citizens have free emergency services to all people, and that is including undocumented citizens that come into the country seeking health care. They don't ask to see papers on where they're from. They just treat all emergency. They treat with no charge. There is a high degree of poor administration in the public system. The public system has problems with staffing that's influenced by labor unions. They offer no incentives to improve health care. There is inadequate information systems, and there's deficits in the facilities and equipment maintenance. There really isn't any money going towards, like, if you compare this to what we have in the United States where we focus on patient satisfaction, there really isn't that in the public system. It's a free service, and that's really what they focus on, is trying to get people taken care of. The private insurance coverage is financed by voluntary prepaid insurance plans based on an estimate of actual risk or direct fee for service. The cost of private insurance premiums averages around $150 per month per person. When you drive around Argentina, or you can see these private hospitals, and the hospitals are in the language of the country that they're from. You see British, German, Dutch, and American hospitals in Argentina. The Obras Sociales is funded and managed by Argentina's workers' unions. Employers and employees both pay into the healthcare system, this particular healthcare system. Only workers employed in a formal sector are covered under Obras Sociales. So if you work like in a hospital, the schools, the government, where you'd be working with a union, you would be covered under this insurance program. The Obras Sociales has problems with mismanagement, which led to many dissatisfied customers, which in turn increased demand for private health care insurance. People with Obras Sociales often pay in addition to have private insurance. People with PAMI also pay for private insurance. So you can see that the people with PAMI can access the public health care providers or go to the private providers. Uninsured groups, if they pay out of pocket, can go to the private providers, but most of the time when you're uninsured, you don't have money, so you have to go to the private provider hospitals. It was my experience when I was there. There was a patient that came into the emergency room at the public hospital, and they treated the person, but they were really focusing on getting the person transferred out to a private hospital. This patient needed dialysis and was taking up a free dialysis machine that was for the public that don't pay, and so that was taking that machine from the person that doesn't pay, because that person that doesn't pay cannot access a private provider. So they were trying to get this patient transferred to a private hospital where they could pay and have room open for somebody that can't pay. So they would rather have somebody that can't pay than somebody that can pay. It was kind of weird. This is the literature review of the healthcare system in Argentina. The history of nursing in Argentina. Dr. Celia Gerson, mother of nursing in Argentina, saw a need to professionalize nursing. She founded the first nursing school in 1891 and authored the first national nursing textbook modeled after the first aid instruction of the Red Cross. She is also the first female doctor in Argentina, but she focused a lot of her work on developing the nursing program. Dr. Ramon Carlillo, he was the Minister of Public Health, and as a public health provider leader, he believed that all existing nursing schools be centralized and their course of study updated. Presently, in 1950, and presently, there isn't a centralized nursing governing body that oversees the nursing program. They're individualized per school or to the hospital that oversees their own nurses, and there isn't any one governing body that oversees all of it. Eva Perón, the First Lady of Argentina, took an active role in the public health that quickly improved the standards of nursing education. Her goal was to have more nurses take care of the people in Argentina. And here she is pictured with her FEP nurses who were instructed on improvements that nurses can offer to the public health. Eva Perón and Dr. Ramon Carlillo were strong political leaders for nursing, and they made huge progress for nurses in Argentina, but their untimely death, coupled with economic and political unrest, stunted the growth of nursing in Argentina. presently there really isn't a nursing leader for Argentina. The literature review for the history of nursing in Argentina. Nursing today. In Argentina, physicians outnumber nurses 3-to-1, which is unusual when you compare it to the United States, where there's more nurses than physicians, but there the physicians are doing a lot of the nursing care because there isn't enough nurses. Auxiliary nurses make up 62.3% of the nursing workforce, and the auxiliary nurse is compared to a nurse aide in the United States. Postgraduate nurses lack instruction on nursing practicum, theory, and research. I did meet some nurses with master's degrees, but they had degrees in like epidemiology or public health, but not nursing. They had nursing degrees, but their master's was in another area that helped them in their career as nurses, but it wasn't a nurse-focused degree. Nurses are migrating from developing countries, compromising the healthcare in Argentina, since Argentina is not a developing country, but it is, because of the war, that a lot of nurses are still leaving the country of Argentina looking for better opportunities. There's a lack of public policy and a commitment to nursing in Argentina, and the nurses have low salaries, economic stabilities, and a limited opportunity for professional growth. This is the literature review of nursing today in Argentina. Needed enhancements to the nursing education in Argentina. There needs to be strong nursing leadership. Strengthening the nursing program by regulating it under one governing body. All nursing instruction should be committed to disease process, health promotion, and disease prevention. Ethical accountability. I'm going to pause on this one. Ethical accountability. The nurses that work in the public hospitals are protected under the labor unions. The labor unions, there's more than one labor union, so the labor unions compete for the nurses for them to pay into their union. And so if a nurse would call in sick for long periods of time, the union that can get her not fired is usually the union that most of the nurses will go to. So they compete that way. So there's a question of ethics when it comes to being a nurse and working in Argentina. They need to be committed to their healthcare policy, healthcare financing and economics, the legislative process, evidence-based practice and research, skills of negotiation, collaboration, and conflict resolution, and nursing theory. The nursing curriculum should be designed to attract students from all provinces of Argentina. So when the students graduate, they are interspersed throughout the country. Currently, there's a need for primary care in the poorer provinces of Argentina, especially the northern provinces are the more poorer provinces. They have limited access to health care. They have to travel into the bigger cities like Argentina or Rosario to receive health care. The nursing schools should be structured around supporting a mission that promotes health care to underserved communities. Currently in Argentina, there isn't a nursing theory or theorists that any particular program models their care by. Dorothea Oram and her self-care deficit theory, or Imogene King goal attainment theory, Nola Pender's health promotion model, Madeline Leininger's transcultural theories are all theorists that any nursing program in Argentina could model their health care after, or their nursing programs after. There needs to be a change in the public image of nursing to reflect higher academic learning and fair compensation. Nurses need to be monetarily incentivized. The current nurses to become active in hospital committees, community service, achieving educational advancements and certifications, and becoming mentors to new nurses. Incentives for nurses. Educational scholarships should be considered for nurses who work in underprivileged areas, for those nurses who achieve continuing nursing educations, for those nurses who access membership to medical professional organizations, achieve certifications, enroll in professional enhancement programs, and especially to those nurses who want to achieve higher professional training, such as a nurse practitioner program, if it should ever be offered in Argentina. This is the literature review of the benefits of enhancing the nursing program in Argentina. Nurse practitioners in the United States, NPs are registered nurses prepared at the graduate level program to provide advanced care directly to patients, trained to take detailed medical histories, perform complete physical examinations, diagnose and treat medical conditions, illnesses and injuries, prescribe medications, refer to specialists, counsel, educate patients and families concerning health maintenance and disease prevention. NPs practice independently and autonomously in many states and can perform many high-level primary care tasks. The role of the NP is to promote well-being and quality of life throughout the lifespan through education, restorative and supportive care, and research. NPs provide holistic care to people in need of comprehensive health care, utilizing nursing theory in their everyday practice, geared not only towards healing and the disease process, but also to supporting the choices of the persons and communities based on environmental factors and cultural and spiritual beliefs. There's satisfaction guaranteed with nursing practitioners. In a standardized survey of 1,601,828 veterans, which is a large study, that examined the differences between patient satisfaction with care provided by NPs and physicians, the study indicated that most primary care clinic patients would rather see NPs than physicians. NPs are a completely different profession than that of a physician, with entirely different paradigms, yet having and obtaining a common goal of healing the patient. The theory to improve health care in Argentina with nurse practitioners. There's a shortage of primary health care givers in the poorer provinces of Argentina. Most of the physicians, when they work in Argentina, are in the centralized cities, the larger cities, and are dispersed throughout the country. NPs have historically thrived in settings where physicians were unavailable, including places that they were unable or unwilling to go. So the solution would be to have consulting primary care physicians collaborating with NPs in the rural health clinics. Literature review to support the theory to improve healthcare in Argentina with nurse practitioners. This is my personal experience in Argentina. The nephrology group I went with, Dr. Mariano Di Miguel and Dr. Christine Valvey and Dr. Luis Santandedo. Dr. Luis Santandedo actually wasn't there during the during my time there. Since this is a public hospital, and I mentioned before, the hospital really wasn't that clean. And as I passed the information desk, there was a cat that lived there. There's this little box that he lives in, and there's cat food and water on the floor for the cat, and there isn't anybody at the actual information desk, just the cat. So I thought that was interesting. This is Dr. Christine Valvey with her PD nurse Sarah, and one of the nephrology residents. Dr. Valvey was asked in 1999 when they realized that the hemodialysis in Buenos Aires was unsustainable because of the limited numbers of hemodialysis machines, together with poor maintenance that led to poor service outcomes. They decided that maybe perhaps PD, peritoneal dialysis, can be offered to some of the people. So she took on that challenge. But as the problems that she encountered while trying to develop the PD service in Argentina and in Buenos Aires is that she received no collaboration from the surgical physician staff and resistance to give operating room time to place the PD catheters. She had no available money made to her from the hospital to purchase the needed equipment and PD solutions. She met resistance from the hospital nursing staff refusing to learn and take care of PD patients. And she received resistance from the nephrology staff, especially the on-call night shift nephrologists and internists refusing to evaluate any PD patient, even if the admitting complaint was not PD related. So if the patient had a PD catheter and came in for pneumonia, they wouldn't see her. So she'd have to be on call 24 hours a day, 7 days a week, and she did that for 7 years. Dr. Valvey came up with solutions to meet these walls that she came up, and with persistence she found one surgeon that had a keen interest in placing PD catheters, and the surgeon had enough pull in the operating room to get surgical time to place the PD catheters. Baxter, the United States healthcare company, stepped in and provided all the PD materials without requesting reimbursement for 15 months. Because the senior nephrology staff was not interested in learning about PD, Dr. Valvey taught the new internal medicine and nephrology residents, so she planted a seed for future collaboration with taking care of night call PD admissions. And then Baxter offered an education stipend to hire and pay a non-hospital, non-union nurse to work with Dr. Valvey, and that would be Sarah. And Sarah actually went on to become the first nurse that has a certification in PD. So in January 2000, Dr. Valvey started her first patient from very humble background and came from the province of St. Louis, which is a northern province. And to date, by 2011, her service grew to 29 active PD patients with more than 100 end-stage renal disease patients who'd gone through her PD service. And she proved that humble patients, no matter their social economical background, can learn to do PD. And she couldn't have done this, and she said that she couldn't have done this without her PD nurse, Sarah. And this is Sarah with one of her PD patients. And these patients, when they say that they're poor, I mean, they really do live in like humble homes. Yeah.